Nursing student girlies, I have a question. I get to take my NCLEX soon for my LPN, and I have been using Archer and I have been using Mark K. I've loved these resources ever since implementing Mark K. My Archer scores have been getting better, and I've been passing my CAT exams. However, one place that I keep falling off is medication endings. So for reference, my program is not an LPN program, it's an RN program, but we are allowed to test for our LPN after the first year. And something that I've noticed over and over again on my Archer exam is there are very specific medications with endings that I've just never heard. I know my Prils, I know my Sartans, I know my Olols, all the general ones. And to be fair, Mark K does say that it's more of a generalist exam than a specialist exam, and I do feel like Archer's questions are very pointed and very specialty inclined, I guess. But I want to know if there's any specific way that you guys remember the endings of medication. And I mean the odd ending of medications, not the basic Olol, Sartans. Like I said, those ones I get. Would you say that it's just gross memorization and just to keep going over it? Or do you have some sort of fancy mnemonic or way that you remember not just the endings, but what it's used for, side effects, adverse effects, peak times, just anything odd about the medication that you should know? Thank you so much for your help. And of course, if you don't know me, my name is Kay. I just finished my second semester of nursing school, about to test for my LPN NCLEX, hopefully work all summer as an LPN, and then continue on my third and fourth semester, and then take my RN NCLEX. Thank you so much for being here. I'm praying for you, and I'm rooting for our success.